Hello, guys. Welcome to Pajon Imaging Hub. In today's education series for all, we'll look at cancer risk assessment. We'll just take an overview of it. Please don't forget to like, share, and subscribe to this channel so that you'll be updated when new video is released. Thank you. Welcome back. Cancer risk assessment is a process used to evaluate an individual's likelihood of developing cancer. So, what is the purpose or aim or the goals of this cancer risk assessment? There are about three things that we seek to achieve by assessing individuals for cancer risk. The first one is identifying individuals at increased risk to help for early detection. And the second aim is to have an informed decision making for individuals and healthcare providers about available cancer prevention, screening, and treatment choices that exist, so that this individual that may have identified itself or have been identified to have a higher cancer risk can be helped to make choices on available screening, prevention, and treatment, so that the effect of cancer or the burden of cancer can be reduced. Of course, which is the third aim, that is to reduce cancer burden. So when an individual undergo cancer risk assessment, we'll be able to know whether he's at high risk. If he's at high risk, we'll be able to introduce the person to available cancer prevention and screening tests, and of course treatments available. So this individual can now make an informed decision on the choice to use, and if he makes a good decision, that can help for early detection of the cancer and of course treatment. And if this is done appropriately, that will go a long way in reducing the cancer burden, which has a high impact, negative impact in socio-economic development of any nation. Now, what are the factors we consider in cancer risk assessment? One of the first factors is we'll look at the family history of these individual patient. Has there been existing cancer in the family? Then we'll look at personal health history. Is there pre-existing cancer also, or specific autoimmune diseases that can increase risk of individual developing cancer? Then look at the individual lifestyle. Are they smokers? The type of diet they take, the physical activity, all these things contribute to affect the level of risk to cancer. Then look at the age. Cancer risk increases as the age increases. Then race and ethnicity. Some race and ethnicity have been identified with some kind of cancer. So there is a higher risk or tendency of individual from such race or ethnicity um, developing such cancer condition or disease. Then environmental exposure, like exposure to radiation. Yeah, like taking medical exposures of radiation, like X-ray, CT scan. Yeah, they have, of course, they contribute in increasing the risk of cancer. If you listen to or watched one of my previous videos on effects of radiation. And of course, I equally stated the reason why we'll continue to do such medical exam that involve radiation. In that video, you will understand how radiation contributes to increase cancer risk. Then there are tools and methods of cancer risk assessment. When you come to the hospital, the care providers assess your cancer risk. They can use all or any of the following methods. They can use a risk assessment questionnaire where you are being given a questionnaire to fill that asks you questions based on those factors that contribute to cancer development or that can affect cancer development in an individual that we have listed already. That is the family history, personal health history, lifestyle, age, race, and ethnicity, and environmental exposures. Environmental exposures is not only to radiation. You can be exposed to some carcinogenic substances in the environment that are not only radiation. There are some additives in food used in food preservation that can have increased cancer risk in individual. Then the care provider can run a genetic test on individual. This can help to identify um, genetic mutations. There are some diseases that are a product of genetic mutation that have been found to increase the chances of developing cancer in the patient's lifetime. Then they can conduct clinical evaluations, they do physical evaluations, and also they can send you to some other diagnostic tests like X-ray test, chest X-ray, CT scan, all manner of exams just to evaluate, like the tumor markers also, and they don't just to evaluate the patient status or to assess the cancer risk level. Then we'll have a cancer risk calculator. This one can be designed. There are many cancer risk calculators. Can be designed to encompass many of the factors used in cancer risk assessment. And in such calculator, certain values are assigned or contributing power to these factors based on the patient response, which is coded and queued in the calculator. The calculator can give a grade, a range of cancer risk where the patient falls. The patient can be in low risk, moderate risk, or high risk. So early detection of cancer starts with the cancer risk assessment. Thank you. Share and subscribe. Bye for now.